Okay, today we're going to be inspecting the abdomen. The first thing I'm going to look at is the symmetry and contour of the abdomen. So I'm going to get at the person's head and examine it from the head down towards the legs, and the abdomen looks rounded in appearance.
Quit talking about my belly.
Now we're going to check for any bulges by looking along the abdomen and checking for shadows. I noted none, and the abdomen looks symmetrical bilaterally. Okay, now it's time to inspect the umbilicus. It appears midline. It's inverted, no swelling or redness or inflammation noted, and no hernia present. So everything looks normal. Okay, now we're inspecting the color of the abdomen. It looks pink, dry, and warm. No discoloration noted, no scars noted, no stretch marks noted. We're going to check the turgor. So I'm going to lift up. Lift up on the skin and notice that it bounces back, so that means that good hydration is present.
And this is your daddy.
Okay, now we're going to assess pulsation and movement. Upon assessment, I note some abdominal breathing, but the aortic is not able to be observed or seen moving in the epigastric region, which is normal. Some people you can see it in if they're really thin, but in this case we're not able to see it. Normal hair growth along the abdomen is noted. Upon assessment, the patient has relaxed expression and normal slow respiration.
How big is the old ring gone or something?
Now we're going to check for bowel sounds. It's important to always listen before you start palpitating the abdomen, because this can increase peristalsis and make false bowel sounds when you listen. We're going to start in the right lower quadrant because more likely you use your bowel sounds in this area first. I was able to hear normal bowel sounds in all four quadrants. Now we're going to listen for vascular sounds such as bruits along the aortic area, the renal and iliac arteries as well. We're going to move clockwise around the abdomen. I didn't hear any bruits, so that's normal. Okay, now we're going to measure the liver span. I'm going to do this by percussing along the right intercostal space until it changes to a more dull sound. Okay, now I'm going to measure it. It looks like it's just over 9 centimeters, which is normal in an adult male. Okay, now we're going to attempt to feel for the spleen along the left midclavicular line. Sometimes you won't be able to feel this if the person's just ate and it's obstructed by gastric contents, but we're going to try to feel for it. Okay, I'm not able to feel for it, so we won't be able to assess this area. Okay, now we're going to assess for costoverbal angle tenderness along the kidneys. I'm going to feel for the 12th rib, and I'm going to place my hand in this area where the kidney should be, and I'm going to do a pound on the back of the back. The patient should just feel a thud but have no pain. Does that hurt?
Nope.
Okay. So that's normal. Now we're going to check for fluid wave. I shouldn't be able to assess a wave in a normal person unless they have ascites. So I'm going to have my patient place your hand like this in the middle of your abdomen. This one. I'm going to place my hand on one side and then press against on the other side. Okay. There was no fluid wave noted, so that's normal. Okay, now we're going to do light palpitation of the abdomen in all four quadrants and then moving into deeper palpitation in all four quadrants. I'm going to check for tenderness, any masses or bulges that are noted, okay? Starting with light palpitation. If it's tender at all anywhere, let me know. Deeper palpitation. Okay. The abdomen was soft, not firm, and the patient didn't complain of any tenderness, and I did not feel any masses. Right. Now we're going to see if we can palpitate the liver. In most people, you're not able to feel anything firm, which might be the liver, but we're going to check to see if we can, because in that case it could mean that it's swollen or enlarged for some reason. Just take some deep breaths for me. It just feels normal. I don't feel anything firm, so I wasn't able to palpitate the liver. We're going to see if we can feel for the spleen. In a normal person, you can't palpitate it. Normally, it needs to be 2 to 3 times larger than normal in order to feel something. So we're going to try and feel for it. Was not able to feel the spleen, so that's normal. Now we're going to try to feel or palpitate for the kidneys. You usually can't feel them, especially in heavier people, so we're just going to see if we can. We're going to put your hands in a duck bill position, and I'm going to ask you to take some deep breaths for me. I couldn't feel the kidneys, so that's normal. Okay, now we're going to palpitate for the aorta. Usually you can feel it pulsating in an anterior position. I can feel it. About 2.5 centimeters, I'd say. That's normal. Now we're going to check their neurosystem. We're going to check all the cranial nerves, and the first one we're going to do is cranial nerve 2, which is your eye. We're going to do this by the confrontation test, and I'm going to ask my patient to cover your hand over your eye on the same side that I do, and then I'm going to move my finger into your peripheral, and when you, the first second you see it, I want you to say now, but look straight ahead at me, okay?
Now.
Okay.
Now.
Okay, now we're going to do the other side. Take your hand down and cover that eye. There you go.
Now. Now.
Okay. Every time that he said now was the first time I was able to see it in my peripheral as well, so that's normal. Okay, now we're going to check cranial nerves 3, 4, and 6, which is eye movement. And we're going to do that by using the cardinal gauges. Okay, I want you with your eyes to follow my fingers. Okay, and my fingers. Eye movement was smooth, so it looks normal. Now we're assessing cranial nerve 5, trigeminal nerve. We're going to first check motor and then we're going to check sensory. I want you to take your jaws and clench them together. Okay. But keep your jaws clenched. I'm going to show here. The muscle strength should feel the same on both sides. Now to check sensory, I want you to close your eyes for me, and then I'm going to rub a cotton ball on your face. Tell me when you feel the touch, okay? You can say now, you don't have to clench your jaws together.
Now. Now. Now.
Okay, so sensation was normal on both sides. Time to check cranial nerve 7, which is your facial nerve. We're going to do motor test first. So I want you to open your eyes and close them. Open, close, keep them shut. Okay, smile for me. Big smile. You can open your eyes. Frown. Okay, now blow your cheeks like this. Let it out. Do it again. Let it out.
Oh.
Blow them up. But let me do that.
Okay.
Okay. It was equal on both sides, and facial movement was the same with symmetry on both sides. Now we're going to check cranial nerve 8, which is your ears. Obviously, our patient can hear normal conversation, but we're going to check also hearing softer sounds, so we're going to do the whisper test. I'm going to whisper on both sides a set of numbers, and I want you to repeat them back to me.
3, 4, 6. 10, 10, 9.
Okay. On this side, he repeated the numbers back to me correctly. On this side, he did not give the sequence correct. I said 10 to 9. 10 and 2 sound very similar to each other. So I'm going to repeat it using different numbers to see if he does have adequate hearing on this side.
5, 4, 2.
That time, it was normal.